So the patient is exposed to various allergens, students, here, and the patient is developing symptoms such as cough, shortness of breath, wheeze. So the allergens such as scented products, pollens, pets, smoke, cold weather. What is this phenomena? This is a asthma, common household disease. Now let us see the definition of asthma. So the definition of asthma. Asthma is generally characterized by, it is characterized by symptoms such as shortness of breath, cough, wheeze, chest tightness due to variable and reversible bronchoconstriction, associated with airway hyperresponsiveness, to variety of stimuli. We will also discuss the definition of COPD, then we will see what is the difference. COPD can also be characterized by same symptoms. It is characterized by same symptoms, but they are more persistent, characterized by persistent symptoms and airflow limitation due to airway and alveolar abnormalities, associated with exposure to noxious stimuli. Now in simple words, asthma is a disease with these features. Why it is happening? Because of bronchospasm. What is the nature of bronchospasm? It is variable, reversible. And why this bronchospasm is happening? Because his airway is hyper responsive to variety of stimuli. This is how asthma generally happens. Now you are in your home and there is a person at your door. You are not liking him. What will you immediately do? You will close the door. In the same way, an allergen is reaching your bronchus. Your bronchus is not liking that allergen. What it will immediately do? It will close. This phenomena is called as bronchospasm. Why it is closing? Because it is not liking that substance. What is this called as? Airway hyperresponsiveness. Now coming to COPD. In COPD also, patient will have same symptoms and airflow limitation, but it is more persistent. Why it is happening? Because airway and alveolar abnormalities are there. And what is the reason? Exposure to noxious stimuli. Noxious stimuli means smoking. So in COPD, most important will be smoking history. In asthma, most important will be patient's allergy history. Now for asthma, there is a theory called as hygiene hypothesis. It sounds funny. Being very hygienic and being very clean is a risk factor for development of asthma. This is what this theory says. It was based on an observation from a pediatric hospital in the United States. They have found out that children coming from rural areas were having less chances of asthma, whereas children coming from urban areas were having more chances of asthma. What was the reason behind that? In rural areas, the children since their early childhood were getting exposed to low dose of allergens. Because there was low dose of allergen since early childhood, their immune system was educated not to react excessively. So same thing you can also apply if you are taking a cold water bath after so many days. On the first day you will be shivering like anything. Now if you continuously take for 21 days, on the 21st day, when compared to the first day response of your skin receptors, it will be very less. So what must have happened? In these 20 days, your receptors must have been educated that this is something regularly happening. No need to react excessively. There must have been some tolerance developed. So this is regarding hygiene hypothesis. This is just a theory, not yet completely proved. So write down few exposures in early childhood. Few exposures in early childhood can educate the immune system. It will say don't react excessively because it is regularly happening, and that will protect against the development of allergic diseases. For your exam, they'll ask you, reduced risk of asthma is seen in children grown near agricultural areas because they are having frequent exposure to low dose of dust. Recent studies have shown hookworm infection and also H. pylori infection. In hookworm and H. pylori infection, these infections can produce a few substances that can educate the immune system not to react excessively. So the reduced risk of asthma seen in children grown near agricultural areas, hookworm infection and also H. pylori infection. Let us discuss once again the important differences of asthma and COPD with help of a table so that you will not confuse again. Asthma is predominantly allergen related. COPD is mostly smoking related. Asthma is a reversible airflow limitation. COPD is a persistent airflow limitation. Asthmatics generally will be young. COPDs will be elderly. What is the reason for COPD to present late? Simple logic. For a patient to develop COPD, he should have smoked for at least 20 years. Now if the patient starts smoking at his 20th year, by the time he reaches 40 or 50, he will be having COPD. Asthma, because it is an reversible airflow limitation, there will be good relief with bronchodilators. COPD, it is only partial response. Whatever guidelines that I say regarding asthma or XENA guidelines, whatever guidelines that I discuss about COPD will be gold guidelines. XENA means Global Initiative for Asthma. This is XENA guidelines. For COPD, it is gold guidelines. It is Global Initiative for Obstructive Lung Disease. It is GOLD. Now if you observe here, asthma is something happening early in your life, mostly reversible. Just like one's girlfriend happens early in your life, nowadays definitely reversible. Whereas COPD is something happening late in your life and mostly irreversible, just like one's wife. You know better whom it is difficult to deal. Definitely it is wife difficult to deal. Definitely COPD is difficult to treat. Sometimes when you don't treat your girlfriend properly, she also will start behaving like your wife. So this is a dangerous condition. When you don't treat asthma properly, it will start behaving like COPD. What is this phenomena called as? Airway remodeling. So write down, if you don't treat asthma properly because of continuous chronic inflammation, there will be some permanent changes in airway. These permanent changes are called as airway remodeling. Because of this airway remodeling, there will be irreversible airflow limitation. What are the features of airway remodeling? There can be subepithelial fibrosis, increased thickness of airway smooth muscle, then there will be increased mucus production, angiogenesis. All these changes put together is called as airway remodeling. Now what is the problem with this airway remodeling? Now if you observe here, this is the normal airway, students. You can see the lumen of the airway is completely open, there are no secretions. Whereas when there is airway remodeling, there is a lot of secretions, and most important thing is the airway smooth muscle. You can see the airway smooth muscle, students, it has increased in thickness, the airway smooth muscle. So whenever the airway smooth muscle increase in thickness, there will be airway lumen narrowing. Now this will function as an irreversible airflow limitation, and that will result in no response to medications. So even if the patient takes medications, there will be no much improvement. Now it functions like a fixed obstruction. So because of that, patient will not have good benefit with medications. Now in this condition, what is the solution? What I do is, I put my bronchoscope into the lung. With help of a specialized probe, I am going to deliver controlled delivery of heat energy, and I am going to reduce the thickness of airway smooth muscle. This phenomena is called as bronchial thermoplasty, students. This phenomena is called as bronchial thermoplasty. This is ablation of airway smooth muscle. Ablation means reducing the thickness. Ablation of airway smooth muscle by delivery of thermal energy. It is not your regular thermal energy to cause burns. It will be a radio frequency thermal energy, and it will be controlled delivery. Because of that, there will be no excessive burning. So it will just reduce the thickness of airway smooth muscle. So once the airway smooth muscle thickness is reduced, airway lumen will improve, there will be no issue. Previously asked question, bronchial thermoplasty is useful in management of which disease? Your answer should be bronchial asthma. Now let us discuss bronchial asthma in detail. There are two types of asthma. One is extrinsic or atopic asthma. As the name indicates, this is the allergic asthma. This is the type of asthma that we see routinely in clinical practice, most common. On the other hand, whose mechanism is not properly known, intrinsic or idiosyncratic asthma. Now coming to extrinsic asthma, it is allergen mediated asthma. And what will be the most common allergen? Most common allergen is dermatophagoids. Dermatophagoids is nothing but house dust mite. because it is classical asthma, serum IgE levels will be elevated, and if you do a skin test, it will be positive for some allergen. Skin test will be positive for some allergen, and this is usually a childhood onset disease. This type of asthma is childhood onset and mostly will remain as mild asthma. Mostly will remain as mild asthma. This is the routine asthma that I see in my clinical practice. Now coming to intrinsic or idiosyncratic asthma. Here the exact trigger is not known. Here the exact trigger is not known. It can be either due to some viral infection, or it can be due to some bacterial toxins, either viral infection or bacterial toxin. Exact mechanism is not known. Because it is not allergen mediated, here serum IgE levels will be normal, and even if you do any skin test, you will be unable to identify the allergens. Skin test will be negative for all possible allergens. This is adult onset disease, and this can present as severe asthma. Severe asthma. This idiosyncratic or intrinsic asthma, it is a rare type of asthma. The exact mechanism is not known. Now in extrinsic or atopic asthma, there is a subtype. What is that subtype? It is thunderstorm asthma. It is thunderstorm asthma. Whenever there are thunderstorms, there will be strong winds. Because of strong winds, there will be dispersal of pollen grains, and patients in that area who are already having asthma, now because of inhalation of this dispersed pollen grains, will develop more symptoms. This thunderstorm asthma is due to dispersal of pollen grains by strong winds, due to dispersal of pollen grains by strong winds. If they ask you in the exam, for atopic asthma, most common allergen overall, your answer should be dermatophagoids. If they specifically mention thunderstorm asthma, now your answer should be pollen. Now your answer should be pollen. Because this extrinsic asthma is predominantly allergen mediated. By giving very low dose of allergen, we can make the body acclimatize to that allergen. This phenomena is called as immunotherapy. In extrinsic or atopic asthma, immunotherapy will be helpful. So what is immunotherapy? You are giving small dose of allergen to the patients daily to improve tolerance to the allergen. It is just like you getting habituated to cold water bath. In the same way, daily small dose of allergen extracts can be given to increase tolerance to allergen. This phenomena is called as immunotherapy. It will be especially helpful in extrinsic atopic asthma.